I was provided for 3 months free accommodation, and for 1 month they provide food as well. The fridge was filled with food.
Would be
So
how to find a reliable agency, because some fraud agencies also will be there.
you can register, and the pay is double there, especially Saturday, Sunday. The pay is like we can make in a day 20K, 30K.
So final question is, what will be the average salary for a person who just started the career as a nurse?
I work in theaters, so I have 4 days in a week, just 4 days in a week.
Hi, Alfonso. Welcome to my YouTube
Hi,
channel.
Doctor. Thank you. Pleasure is mine.
So this video actually, helped many Indian nurses to settle in UK. Many of them actually don't know the process. Knowledge barrier is there actually. So with this kind of videos, and what happens is the information will go to them easy. The first question would be: is BSc mandatory, or with GNM also can we plan to settle in UK?
Anyone can come to UK. Any healthcare people, no matter like nurses, any technicians, anesthesia technicians, GNM, BSc. The floor is open for everyone.
Okay. Got it. So anyone can plan UK.
Yes.
Second question is, so when we start the process, so which website first we have to access?
Okay. So basically, to come to this country, we have to pass the English mandatory exam, either IELTS or OET. So IELTS has been easy for general for all the people, but OET would be definitely good for the people who works in hospital setting, example for nurses and the doctors and the technicians, because mainly the questions would be like hospital related. So I would suggest, if you are planning and if you're working in hospital, OET would be the best option for you.
So OET, if somebody is planning to do, what is the minimum score they need to get in OET?
To come to UK, we have 4 different subjects: listening, reading, writing, and speaking. So except writing, I guess we have to score B in everything. UK will accept writing C+, and apart from everything, we have to get B grade. Yeah, that's a mandatory. Yeah, B and writing C+. That's a mandatory score for everything.
So the thing is, like many Indian nurses would be talking English in a very average or below average way. Like if you take 90%, 10% might be talking good English who are situated in metros, but rest of the Indians' English is not so good. So how difficult it is to pass the exam?
No, to be frank, I have studied in English medium, but I have seen many girls who did OET training with me, studied all the schoolings in Malayalam medium, but then so once we get the PIN, the entire cost of all the process will be refunded to us. So only cost which I paid was my OET exam, that was 35,000. I cracked OET in a second. I mean, in the first shot.
Okay.
I would say this is a negative thinking of every Indian nurses there. So I would say that Indian nurses are really brilliant. So if they can go for a training for 1 month, definitely they're going to crack OET. And this is not a rocket science. We have definitely passed nursing, so OET is gonna be easy if you practice for a month. Yeah.
How much money is required to go as a nurse there? For example, how much money should they save before they should have an idea? No, that is why I'm asking.
Before I could say this, I would say each penny you're spending in India to come to UK would be refunded to you when you come here. Once we come here, we have to give OSCE exam, and then we'll be getting a PIN number, and then we'll be a registered nurse in this country. So once we get the PIN, the entire cost of all the process will be refunded to us. So only cost which I paid was my OET exam, that was 35,000, and my NMC procedure. This is after completing this OET exam, NMC is the next step. NMC first stage and second stage. So it would be like 30,000 something for this NMC as well. After crossing this, we have to go to agency. So many agencies are there, and everything is taken care by the agency. Visas, flight tickets, everything is free. Only the English exam and one CBT exam is the only money which has been spending from our pocket.
So basically less than 1 lakh rupees. That is what you're telling.
Not even 1 lakh, like lesser than 50K. Yeah. That's what I would say.
That much should be affordable, actually. It's not.
Yes. Even that once you crack OET.
Even that would be reimbursed, you're telling.
Yes, they will refund. We have a relocation expense which comes into our salary once after getting the PIN. So definitely each penny will be, they'll give everything back.
So which agency would be, how to find a reliable agency? Because some fraud agencies also will be there.
There is an agent, I came through Medline, and there is
Okay.
Global Agency, and there are a couple of famous agencies, but I
You
would
can
suggest,
send me the links. I'll put in the description
yes,
so that they can
Global, sorry, Global and Medline would be the best, I would say.
Okay.
Yeah, Inverters, there are a
They
couple
can
of,
choose one of that.
yeah.
Second, accommodation after going there. So will the hospital take care, or you have to find your accommodation? As soon as you go there, you
No.
don't have a place to stay, no?
Yeah. So when we, after the interview process, they would ask us how many months we want. I was provided for 3 months free accommodation. And for 1 month, they provide food as well. The fridge was filled with food. So 1 month food and 3 months accommodation was provided for me. And every hospital will definitely provide 1 month or 2 months accommodation. That is compulsory free for everyone.
Oh, super. Very
Yeah.
nice. Coming to the visa process. So visa is a tough thing, not to UK. So
Yeah, but then it is definitely a tough thing. But when the people see that we are coming into healthcare and they know there is lots of vacancy and shortages here, so when they see the nurses or the healthcare associated people applying for the visa, definitely they will make sure it is a bit faster than the normal visas. So mine, they took like 13 days. I did the normal. I didn't give any priority visa. Mine was just a normal. And then I got on my 30th day of visa application. So it was very easy.
got it. So the visa would be sponsored by the hospital, right?
Yes. Yeah. But we have to apply. We have to apply VFS in Bangalore. I did in Bangalore, VFS office. Yeah.
Got it. So then after that, what will be a day schedule there? Like how will a typical day look like?
I work in theaters. So I have 4 days in a week, just 4 days in a week. So 8 to 6 shifts, depends upon the surgeries. And in the ward, it is like 3 days in a week. That's it. Just 3 days and 4 days. We have plenty of offs. Yeah, it's easy to work.
If somebody wants to work in those 3 days also, can they do overtime there?
Yes, they have lots and lots of overtimes. We have NHSP, which is an agency under NHS. We can register and the pay is double there, especially Saturday, Sunday. The pay is like, we can make in a day 20K, 30K. Yeah, in a day. So that's the difference. Yeah. So people majority would pick extra shifts.
So then, so the demand for nurses in UK, you are already told that it is in demand and scarcity is there.
Yeah, it's really high everywhere. Lots and lots of vacancy, and especially they love Indian nurses. I don't know what's the reason, but everyone love Indian nurses. Maybe because we hard work. Maybe, I guess so. I don't know.
So you will settle there, I think now.
Yeah, I'm happy. I'm enjoying my life, and I'm getting respect, dignity, the pay scale, peace of mind. To be frank, so yeah.
So final question is, what will be the average salary for a person who just started the career as a nurse?
The basic pay, it was 25, but then now it's increased to 27. So we have pay according to the band. The lowest is band 5. So the band 5 scale starts from 27 to 31, 32, 33 based upon the region. So I'm outer London. So in London, the pay is more.
Okay.
You got my point, right?
Yeah,
so it's based upon the region we are, and then based upon outer London, inner London. Yeah.
This 25, 37 is per year, right?
Per year. That's 27 is the basic, very lowest.
27,000 pounds per year.
27,655, 27,855 based upon the hospital and trust, but that's the lowest. We can ask them during our interviews, and they do respect our years of experience, and then they give hikes based on experience.
So as a summary, if we have to say, first you have to pass your IELTS or OET, and then you apply through an agency, and
OET, and then second exam CBT, computer based exam, then NMC. That's it.
3 exams total.
Yeah. Yeah.
And
That's it.
meanwhile, agency will take care of the visa process and everything.
Yeah, agency would take care, visa, flight ticket, everything would be taken care by agency. Yes, we have to just wait for the mails. That's it.
Got it. If you want to take your parents also there, is
Mhm.
that provision is available there?
Yeah, to bring my family, I got the maintenance certificate from the HR, so
Okay.
I have to show to the visa so that I can bring, but not more than 6 months, to be frank. But
Okay.
if I get a permanent residency here, I can bring anyone. Yeah, I can
How
sponsor anyone.
permanent residency also is possible. How many years you need to
Yeah,
work there for that?
I have to I have to work for 5 years. Yeah,
5 years.
yeah,
Okay, okay. Super. Very informative for Indian nurses, I
yeah.
feel.
Yeah, recently to my hospital, 2, 3 anesthesia technicians joined, which
Okay.
is really new.
Okay.
So, to all the anesthesia technicians over there who's watching Doctor's channel, I would recommend there is a platform for you guys as well. Please try
Okay.
OET or IELTS. It's superb. Anesthesia practitioners are really valued here. So
Okay,
yeah.
got it, got it. Okay, okay, okay. So
Mm.
how will the weather be in your place?
Today it is drizzling today and it's 10 degree. The weather is okay. I'm
Okay,
okay. I'm adjusting now. It was snowing 2, 3 days back. Yeah, but now it's fine. It's just 10 degree.
10
Yeah, it's
degrees.
cool. Yeah,
It's cold, no?
it's Christmas,
So,
Christmassy vibe everywhere. Yeah, yeah,
so Christmas is a major event, no? There, so good celebration will.
real miss. Yeah, not just Christmas. All the Indian celebrations, which I would say I never celebrated more much in our hospitals, but here they are like it's like a feast here. So
Okay.
it's so lovely. Yeah, it's really nice here. Yeah.
So in your hospital, how many Indian doctors and nurses would be there, roughly on percentage, if you can tell?
In theaters, majorities are from India. Yeah. In orthopedics, I'm a trauma scrub nurse.
Okay.
Our HOD is from New Delhi,
Okay.
Dr. Relvani. Yeah. Majority are from India. Yeah. We have
Oh,
so many Telugu doctors.
okay,
Telugu
okay.
doctors. Yeah. Yeah. Majority.
In nurses also, a lot of Indian nurses would be there.
Uh, Indian nurses are lots in Manchester, but in my trust, Indian nurses are very few. Yeah,
Okay.
majority, yeah, English nurses. Yeah,
English nurses are there.
yeah.
Okay,
But
okay.
that's nice. That's nice actually. We can mingle the culture. We can, yeah.
So
There is a lot of difference.
how many months will it take for us to totally, adapt to that climate and people and everything? How much time
Mm,
did you take to adapt?
when I came here, no matter how many years of experience you have, the stress treat you as a freshness, as
Okay,
a newness. They will teach everything as a new beginner. So
okay,
for me, it was like 3 months of supernumerary period, so that I was a student, and then
okay.
now I'm confident enough after 4, 5 months. Like we'll be knowing everything, the routine, everything. So I would say
So,
3 months.
so before going, you worked in corporate hospitals and metros, which are one of the premium hospitals. So
Yeah.
will that experience help you in practicing in NHS, or you feel it's quite different?
Um, Yeah, a kind of okay, because I worked in Bangalore hospitals, which is really having a high standard levels. And yes, definitely, I don't know whether I can name or not. I have
Yeah.
seen the HOD in our hospital. I
Mm.
would really want to name Dr. Shishir. So
Mm.
here we don't call the consultant doctor, we call Mister. So
Okay.
I would love to address him as Mr. Shishir, because I respect him like anything. I have seen him, the way he is approaching and introducing to the patients, and I can
Mm.
see exactly the same happening here.
Okay.
And then, and I was so surprised. This is what exactly he is doing in our theaters, and he
Okay.
is introducing, going personally. I could see the same thing happening here. So I guess there are so many things which are similar, but there are so many things which is not similar at all.
But you
Yeah,
have to learn new things there. After going there, you have to adapt
yes,
and learn it.
yeah.
Okay. For that,
Definitely, we will adapt.
that will take a year's time, I think, at least to
No,
totally
we
adapt.
have no, we have 3 months supernumerary, 1 month of
Mm.
preceptorship. You will definitely adapt after 4 months. Trust me.
Okay.
You will definitely definitely adapt. They will make you. They'll make us into fit into their group. Yeah. We don't feel
Oh,
separated. Yeah. initial accent problem would be there. I faced the same. It was really difficult for me, but then slowly, you know,
You get
I
it.
got into it. Yeah, I got
Correct.
into that. Yeah.
So the is your trust paperless? No, so in India actually still you have to write everything. So now I think everything is like more of a entry into the system, right? So that will be a change in the practice actually.
Yes, everything is in computer. So the half of the burden is not there, and we have to just focus on the patients. And there are so many people to work on the computers and system. There are similar allocations given.
Okay. So anything else you want to tell the subscribers?
Do watch,
Video will be
subscribe.
watched.
No, any doubts, if you guys need anything, which I can help with any
How can they
information,
contact
I'm
you?
happy to do. They can contact through your channel.
Okay. They can post a
I'm
comment
happy.
with this. You can reply
Yeah.
to the comment. Yeah, that is easy actually.
Definitely I can do that. And anything, any topics, I'm happy to share, because sharing information, if someone is making profit out of that, it's something wonderful, is it? So
Yeah.
I'm happy.
Thank you very much, Alfonso. And
No
this video
problem.
will surely help. Even if it helps one nurse, and if she comes to UK, that will be credit to you only. So thank you very much.
Thank you so much. Thank you so much, Doctor, for inviting me and to be a part of your YouTube. It's really wonderful for me as well. This is the first time.
Q&A we can.
Definitely, Doctor.
3 or 6 months we'll do that.
Yeah.
Okay,
All
thank
right,
you very
then.
much.
Yeah. Thank you.
Okay.
You're welcome, Doctor.
Namaste.
Bye.